Welcome to the Friends of NPACE Podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Hi, everyone, and welcome to another episode of the Friends of NPACE Podcast. You know who I am. I'm Dr. Terri Schmitt. I'm the Executive Director here at NPACE, and of course, a family nurse practitioner, always a clinician. But I am super excited to introduce my co-pilot today in this discussion. She is a guest, but she's definitely the co-pilot. Her name is Lisa Mathis. Lisa's a family nurse practitioner, and she's been in acute care for over 20 years, clinical background in critical care, in pulmonology. She's also a thriller series author that writes about NPs. She has an NP as the lead character. And she's our ANCC program director here at NPACE. And like many of you listening, her life is full of balance because she works with us full time, but she also keeps a clinical practice just like me, Lisa. Oh, and she's a dog mom. Lisa, thanks for being here.
Thank you for having me. I'm so excited. I really enjoy your podcast, and I've done a few also, but I've never been just you and I. So I'm super excited.
I know. We should have done this way before now because
we talk all the time.
And we love to talk about clinical and practice.
That's right.
And the good old days.
So let's just record it.
I agree. Okay, so what we're going to talk about today is something that doesn't show up in the other things NPACE does. It's not clinical guidelines. It's not in a textbook. It's not in a conference. We're going to talk about you and I as true people, like behind the stethoscopes. What's going on behind the learning and what we kind of think as clinicians and how healthcare has changed. So hopefully that'll resonate with our audience who is also clinicians. And one thing I've been struggling with in my clinical practice now for all these years of being a nurse is just like, how do I rediscover joy in practice and like why I'm doing this? So I thought maybe we'd talk about that. Is that good? Or do you want to add anything?
That sounds great. I love that. And hopefully it'll be beneficial to the newer NPs and PAs out there, and as well as maybe give the older, more, I don't want to call us old, Terri.
We're in the back nine, Lisa.
We're on the back nine on the 18th hole. Give us a little upbeat, a little energy lift, maybe. That other we can share that we have the same perspective.
Yeah, and that no one's alone in this. Like we're all dealing with the same things. Okay, so the first part, I just want to talk about maybe like real life of being an advanced practice provider. So when you first became an NP, not even a nurse, first became an NP to now, what feels fundamentally different in clinical? What do you think?
The biggest thing I think, and not just clinical, in the realm of APPs, is the amount of nurse practitioners there are now. Back in the day when I first started, the market was saturated with PAs, and that's what the physicians kind of preferred. And then over the years, it has morphed to where NPs are way up there, and the numbers are huge with practicing NPs now. I think that's the biggest thing I've noticed is that
I actually wrote that down, size of the workforce.
Yep, it's huge.
How big was your graduating class, just out of curiosity? Like how many people were in your NP class?
Oh gosh, I don't remember, Terri. That's been so long ago.
I had like 8.
Mine was bigger than that. Yeah, they were a whole lot more than 8. But I don't remember how many there were. Maybe 50.
But that's a lot.
Yeah. Okay. It was the first online learning at University of South Alabama. It was the first one.
Oh, you went to USA? I love their abbreviation.
In Mobile.
Mm-hmm. USA. Mm-hmm. So they did us in cohorts, and like You know, the university also had a nurse anesthetist program, but that was in a completely, it wasn't even in the nursing department. And you know how they only take so many nurse anesthetist students because they have to, so they did the NP the same way. So there were 8 of us and we were in a cohort and we did every class together. I wrote a thesis. I had to do 4 hours of written comps. They gave me a floppy disk. This is how old I am, people. We had the first computers, and you had to record all of your written comps on a floppy disk and turn them in, and you might not graduate if you didn't pass comps.
It was a lot like that. Our class was bigger, and it really wasn't truly, it isn't anything like the online education today, because we had to go to the university multiple times. Had to go take tests. I had to take finals there. We had to go for clinical. I mean, it wasn't your typical online, but it was the first hybrid kind of online school. So I think they had a pretty good class. It was very hard to get into, very, very competitive. I do think that's a difference now. I think back in the day, NP school was very competitive, you had to be practicing and, for so many years and so many years in critical care and so many years, you had to do this on the GRE or on the MAT. And those guidelines are a lot more lax now than they were back in the day, I think.
Yeah, for better or worse. And it might be a good thing that we don't do all those, but I agree. I liked my cohort. I knew everyone I graduated with. Okay, so I'm getting tangential. Back in the good old days when I walked uphill to school both ways. What surprised you the most when you got out to practice from school? Do you remember?
I do. I hated it. I was a good ICU nurse. I knew what to do, and I remember thinking, by gosh, when I'm a provider, I would do da 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 da. But I did not take into account I was with my ICU patients for 12 hours a day. And when I became a hospitalist and a rounder, I'm with them for a little bitty amount of time, and I had to make decisions right then. So I went from being a very cocky ICU nurse to an ignorant nurse practitioner, and I hated it. And had I not been in debt for school, I would have probably went right back to being an ICU nurse. It took me a few years. Plus, the physician I went to work for just threw me out there, and I was on my own, and it was either sink or swim. I'm happy I stayed with it, but that was a big learning curve. It was hard. It was hard.
Yeah,
What was yours?
There weren't like formal orientation programs. They just like put you in too, and just
no,
you
this is
followed someone for a day or two, and then
he was like, "Go make rounds," and I'm like, "What's rounds? Oh God, you want me to do what? Here, print your list and go see these patients. Make a plan, put orders in." And I'm like, had no clue what I was doing.
Yeah.
I hated it.
Which is not great, right? So I love that we do residencies and fellowships now and like ease people in because you don't learn everything in school. For me, it was the billing, coding aspect, insurance restrictions, medication costs, because I was out in rural health in primary care with a very poor community back then, like mostly uninsured and adult Medicaid. And just like you couldn't get things covered, they couldn't afford medications. And I was like, because I'd worked in a hospital where you just write an order and it happens, right? It magically gets covered and everything happens and you never think about a code or any of that. And yeah, we certainly didn't bill and code as staff nurses. Oof.
No, that was a big learning curve. Yes.
Yeah. What do you think patients don't see about APP practice? Like
what you just said. The things that they can't see, the billing, the coding, the paperwork after hours, the task boxes, the stacks that after we get done seeing 30 patients, the stacks of paperwork this big that we have to go through, the messages, and how time consuming everything is outside of that room that you're in. They see us in a moment in time, and there's so much more than just that one patient, episode there. It's just so much more to it, and they don't see that.
That's exactly what I wrote down.
Yeah. So much more to it. So much more to it than what they see. Yeah.
I would argue that the organizations are the same way, that the only billable time is time with patients. And so they don't see all of those things as well. All of that.
They see it. They choose not to look at
non-patient activities.
And that's your time. That's the part that I did not enjoy, because I love taking care of my patients. That, was the best part of your day. It's the other stuff. And you hit the nail on the head when you said the drugs and the authorizations and the cost and the hours spent on getting stuff pre-authorized. for specialty drugs and arguing with the insurance company and peer-to-peers. Oh my gosh. Peer-to-peers take hours. Patients never see that.
Yeah. What do you think that that's the biggest challenge? I was going to ask you what you think. Every APP clinician, no matter whether they're specialty or where they are, like what's the one thing that we either share or we see as challenges, regardless?
I think it's time management and how to do it all. I mean, because we're supposed to see the patient, be pleasant, be loving, treat them, have the appropriate diagnosis, prescribe the appropriate medications, document in a timely manner, bill appropriately, all that, bring money into the practice. A lot of times APPs are in the management of other staff underneath them, and do all that. We have to be able to do 50 things at one time. That's probably the biggest. And the expectations never, I mean, they just get bigger and bigger. It's more and more.
Yeah, a lot. They continue to be, and mentor students and mentor new people and maybe change shifts. And, oh, can you come in on your day off or help cover additional hours? I mean, that doesn't stop just because you're in primary care and call.
No,
and
that's all the way around.
All right. All right. We talked about all the bad. So despite all the ick, all the challenges, what makes you come back? Why do you still patient practice?
Because I truly, and I've tried to think about that question. I think that's the only thing I've ever been meant to do. I love taking care of people. I love making one person better. If I can make one person better, then I'm happy. If I can, that's very relative, whether that's helping them with hospice and transitioning out of this life, or making them better by having a diagnosis that saves their life when they're in septic shock or something. Just doing a good job and being there for that patient has always been what I wanted to do since I was a little girl, when I wanted to be a nurse. I can't imagine doing anything else. I'm not good at anything else, Terri. That's the only thing I am good at doing.
You're good at lots of other things, I know. Ask Mila. Mila's her puppy. Mila thinks Mama is the best. I agree with you. Like, clinical's the whole reason I do it. That's why I haven't given it up yet. I can write articles and I can teach people and I can lead things, but I like the patients. And sometimes it's just being present with them and making them feel heard. Even if I can't fix the insurance problem, get them the right drug, fix anything that visit.
Absolutely.
It's that. Maybe that's a weird ego thing, but I just feel like healthcare is such a mess and people are shoveled around. And if I could just do that, just hear them. Yeah.
And you and I, even to expound on that, if we are with NPACE, we provide high quality current education. And I feel like it would be very difficult for you and I to do that if we didn't practice on the side a little, because how will we keep current? Medicine is so evolving. Science is so evolving. Everything changes. Guidelines change every 6 months. This drug was perfect then, but this drug has been black boxed and taken off the market now. It changes all the time. How can you and I actually provide great quality education if we don't still practice? We can't.
I absolutely agree. It changes so fast. I'm kind of lucky that I have this job and I know what's going on actually on both sides of it.
Right.
Yeah, we love clinical. All right. So you and I practiced long enough. I do want to talk about, besides the realness of practice, career growth, because that's a long time and no one stays in the same role for 30 years anymore. I just don't think that's typical. And sometimes you have to reinvent yourself. So, and I've done that several times just by the trajectory of a career. Have you ever reached a point where you thought, it's time to do something different?
Absolutely. Thus, I'm employed by NPACE.
What did that look like? Now. How did you know?
How did I know I was done with where I was at?
Yeah, like it was time for change or time to do something different.
I think at the position I was at, we were expected to be pretty much physicians. All APPs had to function like a physician. And I mean that in every sense. The amount of patients we took, the admissions we took, the independence we had. And don't get me wrong, I like to be independent. I've always functioned very independently, but I'm not a physician. I'm not a surgeon. I don't claim to be. I know what I am. And it was very overwhelming. And so I did that for so many years. And then, the physicians can somewhat take advantage of APPs while they sit on the couch and watch soccer and we see 35 patients, that sort of scenario. And when it got to the point where it was changing my personality and affecting my personal life and making me a different person after, 18 years, I decided, you know what? I may not need to do this any longer. And then what really put me over the edge is patient safety. That is my always and has been my first priority. I would never want to hurt someone because I'm overwhelmed or overextended or practicing in an unsafe situation. And it got to that point. So I was done for a little while. And then I found NPACE. NPACE found me, and it was amazing. And this has been a godsend. And I'm still at clinical practice, but not so much that, I'm going to have a heart attack in the mornings. So that's good.
Yeah, no, you said something really crucial there. You said when it started affecting your personal life, you knew it was time to do something different. And I think it's the permission to be done that sometimes we don't feel like is okay. It's okay not to do this thing anymore.
And it was a compilation of a bunch of things. And I at first did not really realize what it was until I would be getting ready in the morning and I would have SVT. Like my heart would be racing. I'm like, what is wrong with me? And it was my heart racing in anticipation of going to that job. And I knew then, and I was just overwhelmed.
Yeah, I think that happens in primary care too. But you mentioned about safety, which I think is a real acute care, a critical care, like when that is unsafe. And I think even bedside and ICU nurses would say the same thing, that can be a real stressor. Right?
It is a very big stressor. And you can, and I'm not telling anyone that's listening, as soon as you feel that way, just leave your job. I followed the proper, the appropriate channels. I spoke with the physician. I said, this is not safe. I don't feel safe doing this, blah, blah, blah. And it fell on deaf ears for months, and to the point that, pretty much the entire staff left. I wasn't the only one. And it was the best decision I ever made, actually.
Yeah, so I think poor working conditions feed in, but when people work great places, sometimes too. So I only once in all my career left a job because I wasn't happy, but otherwise it's always like someone will tap me on the shoulder and go, hey, this place over here is doing this cool thing. You should check it out. And I'm like, oh, I love that thing too. And then I'm like, oh, I go see that. And I go and do it for a while. But I have the best clinical job in the world right now. I work with the best group of people. They're all genius and everybody helps everyone. And there are places that work like that. Just saying, I never feel alone.
You said something crucial too. The sad thing about that scenario is I love that job. So I'm having some hypocrisy there. I love that job. I love the hospital. I love the nurses, the people, and some of the physicians are my best friends to this day. It was the current administration that put us in an unsafe situation.
Oh, yeah.
So I was actually very sad to leave. That I was devastated. I had some of the same pages for 18 years. And so I was so sad. And it was probably the hardest thing I ever had to do because my patients were so sad. And they cried and they were just devastated because but I had to do it for myself. And I still work there, but not full time, obviously, just once in a while. And that's all I need for my clinical, keep me up, and it doesn't drive me as crazy. And we did make a change. I would like to say that all of us leaving and taking a stand, they did change things. They changed the patient ratio. They changed. Yeah, it was powerful. We did take a stand. We did defend each other. It took a lot of staff leaving, but it did make a change within their policy and procedure.
I totally agree. That's awesome that you did that and that you took a stand. And I'm glad to hear that they changed their stuff. I don't think careers are a straight line. It's not like I got to do this and then I got to move into management and then you can go wherever you want. That's the beauty of a clinical degree. So like you've helped onboarding new and mentoring new people. You've done teaching. You're now ANCC program director with NPACE. You worked pulmonology. You've been critical cares. Like, Did each of those things give you something for the next thing, or do you use them all every day? Like, was it insightful to have those
Absolutely.
different
And
paths?
it built on my career because they were at different times. I taught before I was a nurse practitioner. That was when I was a nursing professor. And so that, helps me in education and management. And then I was a nurse practitioner and I managed an office and had a quite large staff. So it's all, built on one another. And little pieces of that I bring with me everywhere. So absolutely, absolutely. And I don't regret any of them because they have been stepping stones within my career for sure.
Yeah, I think it's cool to change careers sometimes and you
Oh
bring what
gosh.
you had from the old place to the new. I know it's helped us at NPACE, your insight into critical care. So, um, circling back to just people who need a job change, when does somebody just like need a break, like a vacation, or they are truly burned out? Like when is it time for a new challenge versus, wow, I should think about working at Starbucks for a little while making
I think
coffee?
I think what I said earlier is when it starts affecting your health and your personal life. That's when I knew. I, I think my body knew before my
Oof.
mind caught up because I truly was
Yes.
having such physical symptoms and I'm like, what is wrong with me? And it was the stress of that job because I was fine for the 7 days I was off. But the 7 days I was on, I'd be like, oh my gosh. And it was just the stress of that job. And like I said, some of my coworkers have made the good point of their personality change. They had trouble at home because they were so
Mhm.
irritable and so stressed. That I think is when you have the difference. I need a vacation because I'm tired and I need to step away, but it should not physically impact you. I don't think. What about you? What's made you feel like you wanted to step up away from? I mean, you've had some stressful jobs, not just me, Terry.
I have had stressful jobs, but I have loved them all. And so I know when I just need to like rest, but I think it's the physical symptoms.
Hmm.
I get exhausted and it's exhausted beyond, hey, if I take a day or two off, then I feel better and I'm ready to come back. And I see it play out. I get frustrated and angry and short-tempered, and it doesn't resolve with rest. I like what you said about interpersonal relationship. It's just me and Wilbur, so we could ask Wilbur what he thinks about that. But I I have only ever left one job out of like this is not good, this is frustration, and I didn't stay long. I came in and read the writing on the wall, when it sounds so good and you go in and I made it to the 6 month mark and I'm like, see ya. I
Well,
mean,
and
there were
that's
some
smart.
things going on, like they were billing Medicare inappropriately and under other people's names, and
See, I appreciate that.
management
Yep.
communicated inappropriately. And I was just like, I'm a clinician. There's a million other jobs. Bye-bye.
Mhm. But see, I appreciate that, and I love your transparency in that because a lot of people would not have the forthwith to say that like you did. I
Mhm.
left a job after 6 months because of that, and I see we just see what and happened in the news last week.
Oh,
$600 million worth
yeah.
of fraud, and poor NPs and PAs are stuck in the midst of all that. And I've
Mhm.
seen it happen so much because they don't want to get out. You, after 6 months, you're like, okay, I'm going
Yeah,
to get
no,
out of
my
this.
license. Only one
Y-
protecting you is you, man.
Yep. And new MPs, they don't see that. And I see that a lot. I see new MPs and PAs and you get bullied by these physicians that say you're going to do this. And it's just good for you for bringing that up because I hope any new PAs or NPs that have started somewhere and this is a problem, you absolutely can get out. Don't put you work so hard for your license.
Yeah.
Don't
Now, if
don't don't lose it.
don't change jobs every 6 months, people. The
No.
first job out of
No.
the gate is really hard, but once
It
you
is
get some
hard.
experience, but I think, yeah, yeah, I love all the work I had. I've had the best jobs. I have the best job
See,
now.
that's how I feel. That's how I feel. I
The
really do.
greatest team ever. Um, all right, but I am going to go on vacation this week. People don't know that when I run this, but I'm going on vacation and my staff knows. Bye-bye. Bye-bye now. All right, so I think it's okay too to look at other things outside the box. So, what do you think APPs, all of us, NPs, PAs, overlook outside of traditional clinical practice? You do not have to work for someone and do a 12-hour shift or 8 to 5 or whatever.
Well, I mean, in pace, education, very out of the
Yes,
box.
or
Um,
teach.
yeah,
Yes.
teach. There's a lot of clinical reviewers that are remote that just do. chart reviews. There are case management positions where the APP does the reviews to see if, and they do the peer-to-peers. I mean, I did a peer-to-peer the other Sunday and it was with a PA on the other line. Because I was like, "Are you a PA?" He was like, "Yeah." So there's lots of things. There's also a new one, Terry, the content creator with the AI. They're hiring MPs and NPAs, and you can do feed AI content, and it has, it's very difficult, but that's a very interesting job. And AI is so up and coming. I think that's a great space for APPs that needed to be remote or need a break from that clinical grind of 12 hours a day.
Yeah, think outside that. Who doesn't need healthcare? I mean, sports franchises use NPs and PAs. I have a friend who's the civilian NP for the military. Home health doing Medicare initial exams and going to people's houses, wound care. I think about the lady we just had at the Cape Cod conference. I got in her van, the 2U pediatrics lady who she just has her little van and it has the whole exam table in the back. We have a podcast on that if you want. But she did that on her own. She got a small business loan and she just drives to people's houses, sees the sick people, only takes cash, does not bill insurance, and does her thing. So
see, that's outside the box. I love that. And there's so many things you can do. You can work from home. You can work from the back of a van that you create. I mean, there's so many things you can do. But yeah.
Lynn Rapp-Silver, one of our friends from an NPEN, she worked and did hepatitis C treatment and liver lab review for inpatient substance abuse because people would come in positive for hep C for inpatient rehab. And she would just go in and advise them and write the scripts and monitor their labs. I'm like, that is so genius. Why didn't anyone ever think of that? Well, she did.
Well, and you could do chart reviews for attorneys. I've done that. That's super fun. I love that. I think I wanted to be a lawyer first. I think that I would have been a good lawyer. I love to argue.
You would have been
you would have been a great lawyer because you love words and documents.
I do love words.
Love words.
And documents, yes, and contracts. I do. If I'd only known they make $450 an hour. Missed that boat. But I would have gotten to put a stethoscope on anyone or look at cool rashes or cast someone or put a pessary in someone. All the things.
I may pick law school for that, Terry, but okay.
Oh, all right. So we talked a little bit about this. So I have experienced APP friends, and some of them are they're in that burnout and exhaustion, and so they're leaving. What do you think's driving them completely out of healthcare? Do you think we've jaded them, or?
I think what we've just touched on, I think that the demand for us to do more, it just keeps getting add on. And I love EMR. I love AI. I think it's great and we need it. But with that, you're expected to see more patients. They increase your load. They increase the patients you see. They increase, the documentation, and you do and do and do, and it's never enough. And you get to the point that you're done. And the lack of, and the field is saturated. I do think that's part of it, but the lack of appreciation at times, I think. Expectations are higher. Appreciation is lower. That's probably the best way I know to describe it.
Yeah, and I would say there's not, in all of my years in practice, I don't think there's been a big upward shift in income. I think how much things cost and people still kind of make what they made 20 years ago entering practice. So I think I don't want to not say the money isn't something. The money's something. Now, that's not the only reason we practice, but you got to pay your bills.
Well, and I didn't want to say that. They want you to work more, but you get paid the same. You need to see 10 more patients a day, but your salary is not going to change. Or we're going to take this bonus away, or we're going to take your continuing education money away, that sort of thing. And so people do leave, which, just like we discussed, there are times you need to step away and try something differently.
Yeah.
And then you've got competing companies like telemedicine or the AI content people. They pay far more than a lot of companies.
Yeah, for a
Mhm.
little less stress. I will say, and I really actually like AI, so they've incorporated it into our clinical by writing it into the systems we already have in the charting. So like the patient will do an intake form, and then I just hit a button and AI will
And it
summarize
populates it.
my
Mhm.
subjective and objective data for it has saved me so much time. And
Yeah,
it
it's
truly
great.
reads like a story. It's not that checkbox
Mhm.
epic crap. Sorry,
Mhm.
Epic, but we don't love you. We
Yeah,
don't.
it does. But see, the problem with that wonderfulness is they say, okay, your charting's quicker, add 10 more patients, and you make the same amount of money. So
I
some
get to
people
spend
are,
more time talking to my
yeah.
patient now instead of instead of
Wouldn't that
doing
be
this during a
great
visit.
in a perfect healthcare world?
Yeah, I love spending time with patients and teaching them. And I love access to care. It's just always been a value of mine. That's why I still practice. People need access to care. Um,
Absolutely.
what, so we've kind of talked about this. If you were going to talk to APP leaders or organizational leaders and say, this is the secret sauce for keeping your APPs, which is going to improve your patient outcomes, which is going to improve your scores and your HEDIS and all those things. Like, what is part of that secret sauce that organizations need to know about helping APPs thrive and stay?
I think we touched on it. I think it's making you feel valued, and that is not just by salary. I think it's things like, of course, salary, the work-life balance, and continuing education. Like, a lot of these big companies stop doing that. And so, that's a struggle for APPs to get good quality continuing education. So I think making their APPs feel valued, when I managed a large office, let me tell you, the bonuses were great because I had the checkbook. And I made sure our nurses, our MOAs, our receptionists got big, huge bonus. They really hated when I stepped down from that position because their Christmas bonuses were, but I made sure they felt valued. And we had the most staff retention. The 10 years I did that, we did not lose anybody because they felt important, and it wasn't just the money, it was telling them thank you and just a little, a special something just to let them know, I knew you worked really hard yesterday. I know that patient yelling at you was stressful. Let me buy you a little massage. That yesterday was rough. And making them feel valued and important and that I valued their hard work made all the difference in the world. And we had a great staff for about 10 years. We didn't lose anybody because they were so happy. But then, a new doctor came and he's like, who's writing the bonus checks? You're like, me. So I lost that. And they took the checkbook away from me, Terri.
I'm sorry. I do think making your people feel valued and it's seeing them each in their own moments with their own thing. So I think that's really important. I hear what you say. Everyone's cutting CE. Not only do they need to keep CE money, they need to make sure their people take it and go away to CE,
Yeah.
CME events.
Mhm.
That's really important, at least one a year. I would say organizations are missing the boat by not mandating at minimum of 2 weeks in a row off for every clinician. And
Love
it can
that.
be done. You just build it into the system, but you need to mandate that your people are out. My current clinical practice, I just work for them part-time and I love it. I love it. But all of their full-time people get a sabbatical for a month. They can take once every 2 years and be off an entire month, and the system supports it. They
I
just
have
staff other
never
people.
heard of that. That is
Mhm.
outstanding. I've never heard of that. That's awesome.
Genius, right?
It is genius. Are they hiring? I love
Probably.
that. That's so, see, that right there is so refreshing. Not heard of a lot. I don't think I've ever actually heard of that. That's great.
And if you know it's coming and you staff appropriately, and even if you own your own practice or it's a small practice, like just be like either we close the practice and another
Hmm.
practice takes patients and we switch back and forth. Like you're going to be gone the entire month of August and I'm going to be gone in July, but you've got to step away. And CE, you've got to send people to
Agree.
things and they have to have access and keep them certified and licensed. Like do those things because it tells a clinician you totally matter. What you're doing matters. Your license matters. All of the things matter. Yeah.
Agree. Agree. And I would like to expound on that. When we have a company that is good enough to provide us with continuing education funds, I think as providers, we need to take accountability for ourselves and do the appropriate thing. Because I know that in this role, and even before I came to NPACE, you would take your CE money and go buy a laptop, turn the receipt in, they would pay for it, and then you would go return the laptop and get the money.
They
Don't
did
do that.
Oh, yeah, don't do that.
Yeah,
Or don't do just
or they do
free
something that's not in
CE
their field. Yeah,
or
do not
that
do anything in their
PDF.
field. Yeah, yeah. So I encourage you, if you have an employer that is so generous to give you continuing education money, use it. Use it on good quality education because it evolves. And I have really learned that a lot with NPACE because I have to sit in all the sessions, Terri, you know that, and hear all the wonderful education and the wonderful speakers. And I've learned so much. And I regret, I beat myself up now that I'm on the back nine that I did not use my CE money because I'm guilty. I did not use it to the now. Let me tell you what, my doctor wouldn't let me off work. I got $2,500 a year CE money. The 18 years there, I used it 3 times, maybe 2 or 3 times. I don't even think 3 times because he would not let me off work. We're too busy. We're too busy. We're too busy. Buy this, and do it online. He would not let me go. Now, it was in my contract, and I should have stood up for myself and said, I'm going. I need it. But I was scared of him, and I didn't know how much I needed it. And now that I have sat in these, I'm like, I really thought I knew a lot, but I really don't. I learn something new every session I sit in, Terri, every session. And some things, and when I review the slides for our presentations, I will screenshot stuff on my phone so I can remember it in clinical practice because there's little tidbits. I'm like, oh my gosh, I never knew. I've practiced all these years. Kim Zuber, one of our great PA speakers. Every time I hear her, I learn something. I'm like, oh my gosh.
I know.
I've practiced 25 years and I just learned something I never heard. So the benefit of in-person continuing education is amazing. And I regret that I didn't use my stuff more responsibly, my money.
Use your stuff, people. I don't know how to convey that because it's so emotional for me because I feel the same way, Lisa. You know, when we sit in a room together, I'm like, oh my gosh, I've practiced 30 plus years. I feel so stupid right now listening to this talk. And I treat patients every week. It's phenomenal. Amelie's dermatology lecture was so good. Wendy Wright's drug updates that we just did. All of these things. Josh Hamilton.
Pick the best speakers. We do really handpick some great speakers.
This wasn't supposed to be an ad for us, but I feel you. There were times where I didn't want to go, or I was too busy, or the kids' stuff at home, and something magical happens in-person CE and CME. I can't even explain what it is.
It's just sitting in there with other, and burnout's real right now, and just sitting in a room with 200 other people that are going through exactly what you're going through. It's that camaraderie. It's just the level. I mean, we've seen some people break out in tears. You know, it's just, I feel you. You learn things sitting in a hot tub, sitting in in a pool, in a bathing suit, having a drink. You're like and you learn valuable things for your practice. Mm-hmm. You know, I've said 100 times in a hot tub in Arizona with my Oklahoma NPs, I learned so many things I'd never heard. I'm like, oh my gosh, this is great. So even if you don't get your continuing education from NPACE, just if your employer is good enough to provide that and give you that support, use it.
Well, and everything's connections. When you do think you're ready to find a new job, it's an event like that. It's someone you met who's like, oh yeah, they worked at Baptist, or they worked at Mercy, or they worked at Atrium. I should call them and see, or email them.
Great connections.
Yeah. All right. So to all the listeners, because we could talk forever about this, I hope Lisa and I mean, our conversations really, if it's reminded you of anything, I hope it's that, 1, you are not alone. 2, there are seasons to a career. They come and go. There's moments. It has changed. The profession's changed. That doesn't mean the good old days were great. It's going to continue to do that throughout. And so that's exciting as well. And it's okay if your path looks different than you imagined it 2 years ago, 22 years ago. I would never, if you had said to nurse practitioner, student, new grad, Terri, working in rural health, that someday you're going to be the executive director of a nonprofit, I would have been like, Nope.
Yeah. And you can't feel, and I encourage everyone not to feel, I think I felt like a failure. Like, I can't leave my patients of 18 years. I can't leave this place. What is wrong with me? And you cannot feel that way. That season is over, but there's so many other paths. And that's one good thing about our career. You can do so many things. You can deliver a baby and hold a hand in hospice. I mean, there's so many different things we can do. We can inject some Botox or take off a skin cancer. So many things we can do in this field. We should not let ourselves get burnt out to the point that we're having SVT before we go to work. We have too many options.
And it's not that the old job will miss you so much. It's that the new job's waiting for you. Like, they need you too, right?
They do. You need it for yourself.
New birth. Yes.
Love it. Yes, love it.
So, I mean, healthcare needs healthcare, and I would say patients more than anything else. They need NPs who are compassionate, APPs, PAs who are compassionate, but they need healthy ones too, and growing ones. We certainly don't treat the same diseases. You don't treat airway and respiratory management the same way you did 20 years ago. We know so much more now.
It changes so much. It's so evolving constantly. Just like diabetes, Terri, you have different guidelines every 6 months. Your diabetes wears me out, girl.
I know. Oh gosh, when I think back to the bebeginning, it was like we had like 3 drugs. And
now it's like, whew,
and now those are bad.
GLP-2.
Yeah.
I lose track.
I agreed. Do you want to add anything before we wrap this up? What do you want all the listeners to know, Lisa?
Oh gosh, I don't know. There's no better profession on earth to me. This is the best thing in the world.
I love it. Being an APP is the best. Thank you to all the listeners who are out there in clinical, who are showing up every day. If you want to tell us, like, if this conversation resonated with you and you just want to meet Lisa and I, maybe chat at an event or have dinner or get chocolate or something. We like chocolate. We like chocolate. I do that. Email us. What keeps you in healthcare? What thoughts do you have about this discussion? You want to join us? Do you want to join us just for a discussion? Maybe you want to come to the podcast. Maybe you want to come to an event.
That. A little open forum podcast. Yeah.
Oh, that would be fun. Okay, so message us. Susan's going to love this. Email us at NPACE, NPACE at NPACE.org. So NPACE at NPACE.org. Find all things NPACE. And the Friends of NPACE podcast at www.npace.org. We're on social media. We're ramping up the TikTok. We got free lectures on YouTube. And we still have a PEDS the rest of this year. We have the PEDS virtual. Welcome to the wild, because it's a jungle theme, y'all. It's a jungle theme. And we're going to Napa for women's health and mental health. Oh, it's going to be so good.
It is going to be really good.
Yeah. What's going to be your favorite topic coming up before we say goodbye?
I'm going to love that whole event. I think the whole event is great. I did my newsletter article on women's health and mental health and how they coincide and hold hands. So I'm super excited about the whole event, actually.
You did that.
Yeah, because, July has some mental health awareness and it's self-care. Self-care. There's a certain day, I think it's July 28th, maybe, is International Self-Care Day. Self-care Day. And I think that women don't take care of ourselves. We take care of everybody, Terri. Everybody but ourselves. So I'm going to love that whole event. I'm super excited about Napa. Love it.
Napa's going to be good. I'm excited about the PEDS virtual. I'm not going to lie. And for you guys who are like, I don't take care of kids. It's for family practice. It's for urgent care. It's for ER. It's all those topics you're not getting somewhere else. So I know we have eating disorders in there. We have autism in there. We have mental health.
ADHD.
Vaccination updates is in there. Did I see urinary?
The use of technology in adolescence. I love that topic. I'm super excited about that because the new studies are just so robust in that.
We're going to have type 1 diabetes in there too. So all of you who are like, I don't know what to do with a type 1 diabetic kid, we're going to do an hour of Down and Dirty.
That's me. Yeah. So I love that whole event. Yeah.
I know. It's going to be, and I mean, we just don't do it. It's not rinse and repeat. You're not going to find this stuff anywhere. But join us. If you want, you can have all those conferences together for free. If you come to Napa, you get the PEDS for free.
Oh, we do. Oh, we are. Yeah, that's great. Who wouldn't want women's health, mental health, and PEDS all in a big old package wrapped up. It's great. What amount of great education.
Lisa, thank you for being here and for still
Thank you for
clinically
having me.
practicing and seeing patients. I think it means a lot to see someone in education who's still practicing, especially in critical care.
Well, I always enjoy our brain time together because even though we practice in completely different arenas and fields, I think we build on each other. And I think that's what makes NPACE so great too, that we have completely different perspectives that we pull together. So it's made our education so well-rounded and not just tunnel vision education. And as I, look at other people's education, I'm like, they're focusing on one thing. We focus on so many different things. So
Agreed.
thank you for having me.
I'm so glad you're here. So if you guys want to see more of Lisa, she has some education at learn.npace.org that we've done in the past. She helped with our radiology conference. She does all things pulmonology. She just spoke in acute care, but you can also come see her live and in person at an event.
And Terri also, who is our diabetes guru. She is. All things diabetes. She's a sweet
And John
one, that
Mayer.
Terri.
John Mayer, if you're listening, my number is, no, just email us at npace@npace.org, John. That works too. All right, to all of our listeners, thanks for being with us. Do reach out to us. Tell us why you're still in healthcare, some tips for other people. We'll gather all those together, but if you want to join us anytime, you're welcome to. And you can find all of our education at npace.org. Thanks, everyone.
That would be great.